With all this talk about sleep deprivation, you may be asking, how much sleep should my patients be getting anyway? The National Sleep Foundation recently published updated sleep duration recommendations after rigorous scientific literature review. Their guidelines include the following durations of sleep for each age group in a 24-hour period. Newborns should get between 14 and 17 hours of sleep. Infants between 12 and 15 hours. Toddlers between 11 and 14 hours. Preschoolers between 10 and 13 hours. School-aged children between 9 and 11 hours. Adults between 7 and 9 hours. And seniors between 7 and 8 hours. You can use these recommendations as a guide, but remember they are just that. An individual's sleep needs may vary, and your counsel to your patients should be based on improving their health regardless of how much or how little they sleep. Assessing your patient for inadequate sleep begins at your first encounter. It may be useful to observe them for signs of excessive sleepiness, such as yawning, difficulty focusing, or keeping their eyes open. Many times your patients will come to you with problems unaware that they are directly related to sleep quality. These complaints could include trouble focusing during the day, daytime fatigue or low energy, irritability, anxiety or depression, weight gain, frequent illnesses, or generally feeling unwell. For children, parents may complain that their kids seem to be more accident-prone, more clingy, more energetic the later it gets at night, difficult to wake in the mornings or after nap time, not eating well, or slow to recover from negative emotions. Even if your patient's reason for coming in seems unrelated to sleep, it is important to get in the habit of assessing their sleep quality due to its relation to so many health conditions and overall wellness. You can take an accurate sleep history by asking as many of these questions that you feel fit. The following questions should be used only as a guide. How many hours of sleep do you typically get per night? Do you have a regular sleep schedule? Do you have enough time to sleep at night? Do you snore when you sleep? Do you experience restlessness when trying to fall asleep? Have there been any recent changes to your normal schedule? Do you work night shifts? Do you wake up feeling refreshed and alert in the morning? Do you ever experience difficulty concentrating throughout the day? Do you feel the need to have coffee in the morning? Have you ever fallen asleep in the middle of the day or during normal activities? Do you find yourself yawning a lot throughout the day? Have you ever awoken from sleep short of breath or with a feeling of being choked? Do you ever have problems falling asleep or staying asleep? It is also important to inquire about any medications to determine if any of them may be related to any sleep difficulties your patient might be having. The first step in assisting a patient regarding their sleep habits is to investigate their sleep hygiene. Before their sleep hygiene has improved, it is difficult to pinpoint other potential causes of sleep loss. An objective score to assess sleep quality and excessive sleepiness can be achieved using one of the available sleep questionnaires. These can function as part of a sleep journal for your patients, allowing you as the provider to monitor improvement in a measurable and consistent manner, and lets the patient identify specific areas they need to improve. These questionnaires include the Stanford Sleepiness Scale, Leeds Sleep Evaluation Questionnaire, or the Epworth Sleepiness Scale. Each questionnaire should be used as directed and can be found in various places online.